Hello, everyone. I'm Shalene from Rhythm of Birth and Postpartum Journey, and I'm excited to come to you today and share a few tips on driving to your place of birth. If you're watching the replay, I'd love to hear your ideas of how to prepare for the transition to your place of birth. I'm going to share some tips with you, and if you're watching this and you are the pregnant woman, pregnant mama, I encourage you to share this with your partner or whoever plans to drive you to your place of birth. So whether you're planning a home birth or hospital birth or birth center birth, it's important to feel ready for that transition when you're in labor. Most people, when they go into labor, their anxiety is heightened and there's lots of questions, there's lots of things they're thinking about, and being prepared ahead of time to make the transition, make the physical transfer to your place of birth can really help to lower that anxiety and help you to have a more peaceful transition. That can also help to encourage the oxytocin or the hormone release of labor. Most women, when they go into labor at home or wherever you are, and you have to make a physical drive or transition to the place of birth, it's very normal for labor to slow down or stall. So it's normal for that drive to the hospital or birthing center or even home if you start labor out and about, for the transfer to slow down or stall contractions. So being prepared ahead of time and your partner feeling prepared for that drive. Partners, that is a big task to drive the laboring woman to the place of birth. With my second labor, I started having contractions at home, and we were anticipating a blizzard that day. This was 4 years ago. My daughter is 4. And we had to drive to town to the doctor's office to have my blood pressure checked. And we were planning a home birth. And we knew that a blizzard was coming. So we were gathering the things we needed. We were preparing to possibly be stuck in the snow. And it definitely increased anxiety as we knew that we had to make the transfer. And my husband's biggest task was to get us safely back home through beginning of 30 inches of snow. And I had trust that my husband knew how to navigate us through traffic and getting us home, and that we had what we needed if we were to be stuck. We had a support person with us, and that really lowered the anxiety for me to remain calm in the car through that transition and helped me to really have the oxytocin flow that I needed to get home, and being 9 centimeters when I walked in the door to get ready to deliver my daughter in the birth pool. So it's important, again, partners, that you feel ready, that you feel at peace, and that you know with confidence that this is your job to deliver the laboring woman to the place of birth confidently, and your anxiety is lowered. So one thing that can be helpful is to do a test run. Even if you're planning a home birth, it can be important to go to the hospital or birthing center that you might be transitioning to or transferring to in the event of that being needed. Or if you're planning a hospital birth center birth, visit that hospital multiple times. I remember I was following a couple to the hospital, and I thought that the partner had been to the hospital multiple times, and through the anxiety of that transfer or that transition to the hospital, as I was following them, they went to the wrong part of the hospital. Mom was getting ready to push. The dad was on the phone with me saying, I think she's getting ready to push. Anxiety was heightened. They were trying to hurry. They were excited and anxious. And I immediately said on the phone, I will get in front. I will guide you to the birthing center, and I will help you get in and know where to go. So not only transitioning to the hospital or place of birth, but when you get there, where do you go? Where is the place that you will check in? Who will you meet the first time? So doing that role play, visiting the hospital, doing a tour can really help to lower the anxiety and for mom to feel comfortable and safe that she is being taken care of and supported in that transition. Also, being ready, getting your car serviced, making sure there is gas in the car. When I'm on call for a client, especially if I'm driving to my hospital that's 45 minutes away from me, I live across the street from one hospital, but I also support couples in a hospital 45 minutes away in Roanoke, Virginia. I always make sure that I have plenty of fuel in my car. I don't want to be awakened in the middle of the night and be on empty and have to stop to get fuel. So it's important to keep your car serviced, keep oil in the car. Just make sure the car is comfortable, that there's not a lot of mess in the car, that mom can get in and feel just that there is a clean place for her to get into. Also being prepared for the mess. Birth is messy, especially if your water has not broken. Or there might be some fluid or discharge. Maybe putting a cloth on the seat or on the floorboard in case there's any mess that happens, to protect your car, and that mom won't feel inhibited like she has to keep all of that in. Mom also wears some big panties or pads, can be helpful when you're going to the car or in the car ride, and also when you transition to your place of birth. The biggest question or thing that most people do when they first start having contractions is time the contractions. In early labor, I encourage my clients and moms to not time contractions initially. And early labor can last 12 to 24 hours or multiple days, and timing contractions can wear you out mentally, especially if it's a longer early labor. And if you're timing them right away, you can just exhaust yourself. So I encourage you to wait till more active labor. And you might wonder, well, how do I know when it's active labor? I believe in your gut. You will know when active labor happens when contractions are more consistent. In early labor, contractions can be several minutes, 5 to 10 minutes, 20 minutes apart. They can be consistent for 15, 20 minutes and then space out and not happen for many hours. But when active labor starts, it's usually contractions happening every 5 minutes, consistent for an hour, and lasting a full minute. It's the 5-1-1 rule, which is a typical active labor pattern. And when they get more consistent, when they get a little stronger, that's when you start timing them. And that 5-1-1 rule is a good rule of thumb to know when to transition to the hospital. And I, as a doula, often meet couples at their home before that time and can help discern the stage of labor or when it is active labor and help you know when the right time to make that transition. I don't tell you that it's time to go, but I can give you an idea of maybe you've got a little bit of time, and you ultimately make the decision on when to go to the hospital or your place of birth. So timing contractions, wait until later on in more active labor, and you can time them for a little while to know when to make that transition. Once you get to your place of birth, especially if you are being monitored continuously, the monitoring will be the thing that times the contraction. So you don't have to keep using the contraction timer on your phone, but you can really, as the partner, really be engaged with mom and focusing on her and not the contraction timer. It's very normal for people to forget to click the timer, to turn it on, to turn it off, and then your whole timing and pattern is really thrown off. So I encourage you to really pay attention to mom once you've made that transition, and allow the staff, the medical staff, or your doula to help you to discern the contraction pattern and just really keep moving and focusing on allowing labor to unfold. Also, when labor begins, it's good to just wait, to allow labor to unfold, not feel like, oh, I got to go somewhere, I got to do something, and increasing that anxiety and that intensity. But just wait, observe, and just rest, take a bath, take a shower, and just really enjoy labor. And then, as labor progresses, like I said, knowing when to make that transition. So another important tip that I have, when you do arrive at your place of birth, especially in a hospital setting or birth center setting, there are lots of changes. There are new lights, there are new people, and lots happening, and it can create internal chaos in the laboring woman's mind. And again, the support role, the doula, the partner, your role is to help to decrease that thinking brain and to really allow mom to feel settled and not have so many questions to her. Often I encourage moms to, or partners, to ask the nurse or care provider, can we have 10 to 15 minutes in the room to just really settle in before a lot of questions are asked or monitoring happens. And I've always had good experience with nurses and care providers saying, okay, just let me know when you're ready and we'll start monitoring. We'll see where you are. We'll maybe do a cervical exam, do some monitoring of your contractions and baby's heart rate. But during that time, during that 10 to 15 minutes, it's helpful for partner or doula to do a visualization, allow mom to settle in, allowing her to feel her body and feel where she is touching, where she's sitting, where she's standing, and really just feel into her space. That can be really helpful as she is allowing labor to continue, feeling that oxytocin again. The rush to the hospital or the environment of driving and being, in traffic or on the road, that can inhibit the oxytocin release. So allowing her to really feel into the space as she gets into her place of birth can help to encourage labor to continue, helping her to feel safe, introducing her to her new environment, visualization, prayer, mantra, whatever she needs. And that really takes discernment, intuition on the partner and doula's part to really help her to feel settled as she makes that transition to the birth center, hospital, or wherever she is birthing.